Hi class, my name is Alejandra Magana and today I'm going to be discussing hemophilia. Hemophilia is a rare bleeding disorder in which the blood does not clot properly. I will be going over the anatomy, physiology, pathophysiology, diagnosis, treatment, and demographics of hemophilia. As you can see in the labeled image above, blood is composed of red blood cells, white blood cells, platelets, and plasma. Red blood cells are responsible for the transport of oxygen and carbon dioxide. White blood cells aid in defense against infection by microorganisms, and platelets enable clotting and release serotonin, which causes vasoconstriction. On this slide, you can see the physiology between a normal blood vessel and a blood vessel with hemophilia. Blood contains many proteins called clotting factors. These factors work with your platelets to form blood clots that control bleeding. When an injury occurs, platelets stick to each other at the wound site and they create a platelet plug. People with hemophilia have low levels of either clotting factor 8 or clotting factor 9. Due to not having enough blood clotting proteins, the blood does not clot properly, and this can lead to spontaneous bleeding. As you see in the image above, platelets and clotting factors will cover up that wound to prevent blood from leaving the wound. But with hemophilia, it doesn't clot properly and blood will continue to exit the wound. Hemophilia is a sex-linked disorder that is inherited in an X-linked recessive manner. This is caused by a mutation or change in one of the genes that proves instructions for making the clotting factor proteins needed to form a blood clot. These genes are located on the X chromosome. Males inherit the X chromosome from their mother and the Y chromosome from their father. If a woman with a defective gene has a male child, that child has a 50% chance of inheriting the X chromosome that carries the abnormal factor gene. There are multiple types of hemophilia. Hemophilia A is the most common and is when there is a low level of factor level 8. Hemophilia B is low levels of factor 9. And acquired hemophilia is rare, and it's when the immune system attacks either clotting factor 8 or 9. Common signs of hemophilia include frequent and hard to stop nosebleeds, heavy bleeding from minor injuries, bleeding into the joints, bleeding into the skin, bleeding of the mouth, and bleeding after having shots such as vaccinations, and bleeding in the urine or stool. If you have hemophilia symptoms, your provider will ask you about your family's medical history and do the following tests. A complete blood count to measure and study your blood cells, prothrombin time test to see how quickly your blood clots, and clotting factor tests which review a clotting factor deficiency and determine how severe the hemophilia is. Unfortunately, there isn't a cure for hemophilia. If you have hemophilia, you will need medical treatment for the rest of your life. How much treatment depends on your condition type and severity. The best way to treat hemophilia is to replace the missing blood clotting factor so that the blood can clot properly. This is known as replacement therapy. In replacement therapy, you receive human plasma concentrates or lab-made clotting factors. Desmopressin is a hormone that can be injected slowly into a vein or used as a nasal spray to stimulate the body to release more clotting factor. Emicizumab is a drug that can help prevent bleeding episodes in people with hemophilia type A. Clot-preserving medications, also known as antifibrinolytics, these medications help prevent clots from breaking down. Fibrin sealants can be applied directly to wound sites to promote clotting and healing. Some people who receive these therapies develop antibodies called inhibitors, which attack the clotting factors that control bleeding. Immune tolerance induction brings down those inhibitor levels, but may be needed for months or even years. Artificial intelligence and hemophilia is still in its early stages, but it has shown to be helpful. AI machine learning helps predict the severity of the type of hemophilia. And AI robotics is used in surgery on hemophilia patients to help minimize incision size and help minimize the bleeding. Hemophilia almost always occurs in males over females. 1 in about 5,000 male births will be a person with hemophilia. Most women with the defect gene are carriers and have no signs or symptoms. Acquired hemophilia rarely happens and it's not inherited. About 10 in every 10,000 people have hemophilia A. 3 out of 100,000 people have hemophilia B, and this is in the United States. The life expectancy of hemophilia patients who are properly treated is 10 years shorter than that of the general lifespan. And these are my references. I hope you enjoyed my presentation. Thank you.